Greetings, friends. Today I'm going to guide you through a yoga therapy practice that targets the psoas muscle, a large muscle that connects to the lower thoracic vertebrae and also the upper lumbar vertebrae. And it goes through deep inside of the belly and down through the pelvis and connects with the inner thigh bones, the lesser trochanters. It's responsible for flexing the legs, and it connects the upper body with the legs. It's crucial for hip mobility and also overall stability. It greatly affects our posture. So let's begin. Please lie on your back. Start with your legs long and your arms by your sides. Attune to your body. Notice what you feel right now within your body. Become conscious of your breathing. And deepen the inhale and lengthen the exhale. Again, inhale deeply and exhale slowly. With your legs close together, this time as you inhale, raise your arms toward the sky and up to the ground as far as you can. As you exhale, bend your right knee, place your hands on your knee, and move your right thigh towards your belly. Hold it for a moment after the exhale. As you inhale, straighten your leg down to the mat, raise your arms up again. The other leg, as you exhale, moving your belly in, bend your left knee toward your chest, place your hands on your knee or shin, hold your knee in for a moment, feel your left hip flexor. Inhale, lower your leg and raise your arms. And then this time as you exhale, bend both knees toward your chest, engaging your core. Bring your hands to your knees or shins or around your legs, holding it for a moment after the exhale. Inhale, straighten your legs down to the mat, raise your arms up. We'll do another round. As you exhale, bend your right knee again. Hold your knee in for a moment, feel your right hip flexor. As you take a deep breath in, straighten and lower your leg, raise your arms. On the exhale, bend your left knee again. Feel your knee bending. And then inhale, lower your leg, raise your arms. Once again, as you exhale, bend both knees toward your chest. Bring your hands to your knees or shins. Hold your knees in, feel both hip flexors. Inhale, go slow, raise your arms, lower your legs. And then as you exhale, lower your arms down to the mat. Separate your legs a little bit. And notice what you feel right now in your hips and in your legs. And then bend your knees. And lightly move your knees a few times from side to side. Just lightly. This may not be coordinated with the breath, but it could be. If it was, as you inhale, come back to the center. As you exhale, move your knees to one side. Maybe your head moves a little bit to the other side. Moving a few times, your head and knees opposite each other. And then come back to neutral and keep your knees bent. Bring your feet to the mat parallel to each other. As you inhale, raise your pelvis, keep your thighs parallel to each other, move your chin toward your chest. And as you exhale, slowly lower your pelvis back down to the mat again. And we'll do that a few more times. Push your feet down into the mat, feel the front of your thighs and hips and belly. And exhale, slowly come down. And this lengthens your psoas muscles and your hip muscles, your hip flexors. Inhale as you come up again. And come down again, slowly, consciously as you exhale. Just one more time as you take a deep breath in, come up. This time, if you can, stay for a moment. Exhale, keep your hips high. Stay here as you inhale. Exhale, stay here. One more, inhale. And then as you exhale, lower your pelvis back down slowly. And either keep your knees bent or straighten your legs for a moment and feel the after effects of the movements. And then turn around, roll onto your side and come onto your belly. Come onto your front. And turn your head to the left, bring your right cheek down. Extend your feet. Bring your hands to the mat, close to your chest. As you inhale, lift your chest and left leg, turn your head to the center, looking forward, holding it for just a moment. And then as you exhale, come down and turn your head to the right, left cheek down, lower your left leg. Inhale, lift your chest and head and right leg this time. Lengthen your leg, reach back through your toes. And on the exhale, come back down, turning your head to the left. One more time. Inhale, come up, lift your chest and left leg, turn your head to the middle. Come down on the exhale, turn your head to the right. And then inhale, lift your chest and right leg, look forward, hold it for a moment, feel the muscles that you're working, especially your leg and hip muscles, and exhale, come down. Stay here as you inhale. Exhale, push into your hands, come up to your hands and knees, and then move down to child's pose. Bring your chest down toward your thighs, forehead down. Take a couple of deep breaths here. And then as you inhale, come up to your hands and knees and lift your left leg and flex your ankle, push back through your heel. And as you exhale, lower your knee, bend your knee, lower your chest toward your thighs again. Inhaling, lift your chest and right leg this time. Lengthen your leg, flex your ankle. And on the exhale, bend and lower your knee, lower your chest toward your thighs, forehead down. Once again, left leg, inhale, come up. Hold it for a moment, lifting your chest, keep your hips level. Exhale, lower your knee, bend your knee down to the mat, forehead down toward your knees or wherever it's comfortable. As you breathe in, come up, lengthen your right leg, flex your ankle, point your toes down, keep your hips parallel to the ground. And on the exhale, bend and lower your knee, lower your chest and head. Take 1 or 2 deep breaths here. Feel your body relaxing. And then from here, come up to standing in your own way. Stand on your feet. Have your feet parallel to each other. Shift your weight a little bit from foot to foot. And then come onto your right foot. And then lift your left heel. Come to the ball of your foot, your toes. If you can, lift your whole foot, bend your left knee in toward your chest. Bring your hands to your knee or shin. And draw it in toward your chest. Draw your knee up toward your chest. Lengthen your spine. Stay here for a moment and breathe. Feel your left hip joint, your left hip flexor. Take 1 more deep breath in. And as you breathe out, lower your foot. And notice the difference between your legs. Then we'll do the other side. Lift your right heel. And then, if you can, lift your whole right leg, bend your knee up toward your chest. And stay here for a few breaths. Keep lengthening your spine. Move your shoulders back and down. Long neck. Feel your right hip flexor. And breathe. And balance. One more inhale. And then exhale. Lower your foot. Shift your weight a little bit. We'll do another standing pose. Come onto your right foot again. Bend your left leg. This time, bend your leg backward. If you need to keep your toes down, that's okay. Moving your toes backward. If you can, bend your left knee. Take hold of your left ankle with your left hand. Keep your knees close to each other. Maybe just stay here where you are with your knee bent. Or lift your right arm as you inhale. And then push your left foot into your left hand, gently arching your back a little bit, folding forward a little bit, staying here for a few breaths. And feel the lengthening of your left hip flexor in this position. Find your posture, make it your own. One more breath here. And then as you inhale, come back to neutral. And as you exhale, lower your right arm and left foot. Shift your weight a couple of times from foot to foot. And then we'll do the other side. Now bend your right knee. Maybe move your toes back if that's what you need to. For balance, it's okay. You'll get some benefits even being just in this position. Or bringing your foot up, taking hold of your right foot, keeping your knees close together, or touching even if you can. And then as you inhale, take your left arm up. And then if comfortable, arch your back a bit, push your right foot into your hand, and stay here for a few moments, focusing on the front of the right side of your pelvis, your right hip flexor. Breathe. Also feel your quad, right quad. Find your position, your posture. Stay here for another breath. And then with your next inhale, take your arm up, come back to neutral, and exhale, lower your right foot and left arm. Shift your weight again and notice how your legs and hips feel right now. And then from here, come down to your knees. And step your right foot forward, big step forward. Make sure your foot is ahead of your right knee. And bring your right hand to your right thigh or knee. Let your left arm just hang by your side. Inhale in position and exhale. As you inhale, bend your right knee a little bit further and take your left arm forward and up. Feel that to the front of your left hip. As you exhale, lower your arm again and lengthen your right leg. Come back to the starting position. Inhale, again, lounge, take your left arm up and maybe a little bit back if comfortable. Then on the exhale, lower your arm again, lengthen your leg. Just one more time. Inhale, take your left arm forward and up. Now if you can, bend your left arm on the exhale. Bring your hand between your shoulder blades, somewhere your upper back. And place your right hand on your left elbow. And then lean a little bit forward and rightward. Stay here for about 3 breaths. Again, focus on your pelvis, the left side of your pelvis. And then after about 3 breaths, with your next inhale, take both arms up. And then exhale, lower your arms and straighten your right leg. And we'll change sides. Bring your right knee down to the mat. And then bring your left foot forward. Place your left hand on your left thigh or knee. Right arm is by your side. Inhale. Exhale. As you inhale, take your right arm forward and up, lounge. Feel your right hip. Notice how it feels on this side. And then on the exhale, go slow, lower your arm and lengthen your left leg, keeping your foot on the mat. Again, inhale, lounge, move your hips forward and downward. Feel the lengthening of those muscles there in your pelvis. And exhale, lower your arm and lengthen your leg. One more time as you breathe in. Take your arm forward and up, a little bit backward maybe. As you breathe out, bring your hand between your shoulder blades. And then place your left hand on your right elbow. And then lean a little bit forward and leftward. And you might notice a deepening of the lengthening of the muscles from your right knee all the way up to your chest, the whole right side of your body, from your knee to your chest. After about 3 breaths here, inhale, take your arms up. Exhale, lower your arms and lengthen your left leg again. And then bring your left knee down. If you'd like to come into child's pose for a moment before we come onto the back again. Transitioning your own time. Coming to lie on your back. And just feel for a moment before we do our next set of movements. Re-enter your living body. Become aware of your soma, your living body, your inner body. And then bend your knees. Move your knees toward your chest. And place both hands on top of your left knee. Both hands on your left knee. As you inhale, straighten your right leg until it's parallel to the ground without touching the ground. If you can, point your toes. As you exhale, take your right leg up and flex your ankle. Point your toes down. On the inhale, lower your long leg down toward the earth again. Point your toes. And exhale, bend your knee. Feel your right hip flexor again. And repeat that. Inhale, straighten your right leg until it's parallel to the earth. Exhale, raise your leg until it's perpendicular to the earth. Inhaling, slowly, mindfully lower your leg, point your toes, stay present in your body. Exhale, bend your knee toward your chest again. One more time if you can, or rest if you need to. Inhale, straighten your right leg. Keep your left knee close to your chest. This protects your lower back. Exhale, take your leg up, flex your ankle. Inhaling, lower your leg, extend your ankle. Bend your knee on the exhale. Take a free breath with both knees toward your chest. Notice the difference between your right and left hip. And then bring your hands to your right knee, and as you inhale, straighten your left leg down. Notice what it feels like on this side. Exhaling, take your leg up, flex your ankle, move your heel up. Inhaling, lower your leg slowly. Feel the work in your left hip, feel the muscles that you're contracting there. Exhale, bend your knee back in toward your chest. Twice more as you breathe in. Lengthen your leg down toward the earth. Breathing out, take your leg up toward the sky. Flex your ankle. And then inhaling, lower your leg. The slower you move, the more power and control you have. And exhale, bend your knee again. One more time. Inhale. And exhale. And inhale. And exhale, bend your knee. And then bring both knees in toward your chest again. And then lower your legs down to the mat. Pause for a moment. We're sort of alternating between stretching or lengthening the muscles and strengthening them. Notice the circulation into your pelvis, the nutrients, the oxygen. And then come onto your right side. Rest your head on your arm. Or if you have a pillow or blanket or anything else nearby for your head, you can rest it on that. Bend your knees. And now bring your left hand to your left ankle. And then take your leg backward. We did something similar to this in standing. And stay here for a moment. Maybe it was hard for you to do this in standing, maybe impossible or easy for some. This is probably relatively doable for most of you. Stay here for 2 more breaths. And again, feel that to the front of your left hip, left thigh. And then with your next exhale, come back, bring your knees together, and then do the same on the other side. Change sides, come onto your left side. Rest your head on your left arm. Bring your legs together. And then this time, take hold of your right ankle and move your right leg backward. Go as far as is comfortable without hurting yourself, of course. And stay here for a few more breaths. And notice what that feels like in your right hip, right thigh, your belly on the right side. Stay here for 1 or 2 more breaths. Then with your next exhale, move your knees together, bring your legs together, releasing your foot. And then come to lie on your back for the last movements for today, for this practice. Feel again. Feel the sensations that you have created. Bend your knees. As we did earlier, lightly move your knees from side to side a few times. Again, this could be coordinated with the breath. Inhale as you come to the center. And exhale as you move your knees to one side. Your head might move the opposite way as your knees, moving a few times from side to side. Just a light twist here. This also benefits the psoas. Also an important muscle for releasing back pain, releasing the psoas, strengthening the psoas can help reduce back pain or free yourself even from back pain. Then bring your knees to the center, your hands to your knees. Inhale, straighten your arms, move your knees arm distance away from your chest. And as you exhale, bend your elbows and move your knees toward your chest. A few more times. Inhale, lengthen your arms, and exhale. And feel this movement in your hips, deep inside of your hip joints. Breathe as you move. And move as you breathe. And then come into your relaxation position, either with your knees bent or your legs long. Have your legs a comfortable distance apart. Rest your arms a comfortable distance away from your body, perhaps palms up, which allows your shoulders to relax down. And become aware of your legs. Become aware of your hips. Feel the sensations that are alive right now within your pelvis, your hip joints, also in your sacrum and your lower back. Scanning through your body, relax your body. Keep your mind present. And stay here for a couple more minutes at least. And then notice as you get up, as you go about your day, your activities, notice if this has made a difference. Notice if your posture has improved and if you overall feel better inside of your body. Thank you for your participation. And please like, subscribe, and share.